Hello everyone, you're welcome to my YouTube channel. I'll be discussing pathotypes of Escherichia coli as causative agents of childhood diarrhea. We'll look at the definition of diarrhea. Diarrhea is defined as the excessive loss of fluid and electrolytes with the passing of at least 3 stools with abnormal appearance. It could be loose, watery, or with mucus in 24 hours. Having any of the following symptoms will also indicate that the patient is having diarrhea. These symptoms include nausea, vomiting, abdominal pain, or fever above 37.2 degrees Celsius. These symptoms may lead to dehydration and death. What is the etiology of pediatric diarrhea? The etiology of diarrhea can be non-infectious or infectious agents such as viruses, bacteria, and parasites. For the purpose of this video, we'll be discussing Diarrhegenic Escherichia coli, which is a bacterium. Diarrhegenic Escherichia coli is the leading causative agent of childhood diarrhea or pediatric diarrhea in developing countries, especially children under the age of 5 years. Diarrhegenic Escherichia coli can be classified into 6 major pathotypes based on their specific virulence properties. These include enteropathogenic E. coli, enteroaggregative E. coli, enterotoxigenic E. coli, enteroinvasive E. coli, fecal toxin producing E. coli, or enterohemorrhagic E. coli, and diffusely adherent E. coli. The first pathotype to be discussed is enteropathogenic E. coli. Enteropathogenic Escherichia coli was the first pathotype to be described as the etiological agent of E. coli infections. It's a major cause of infantile diarrhea in developing countries. And the major characteristic intestinal histopathology associated with enteropathogenic E. coli is the attaching and effacing lesion. The bacteria adhere to intestinal epithelial cells through an adhesing molecule and cause prominent cytoskeletal changes. These include accumulation of polymerized actin directly behind the adherent bacteria. Enteropathogenic E. coli uses bundle-forming pilots to attach to the small intestine and penetrates the microvillus structure. Diarrhea may occur through active ion secretion, intestinal inflammation, increased intestinal permeability, loss of absorptive surface area resulting from microvillus effacement. Enteropathogenic E. coli infection in infants is severe with watery diarrhea, vomiting, and fever, which is usually self-limited but can be prolonged or chronic. The second pathotype of E. coli is enterotoxigenic E. coli, which is a very important cause of non-bloody acute diarrhea among infants in developing countries, leading to rapid dehydration. The colonization factors of enterotoxigenic E. coli promote adherence or attachment to epithelial cells of the small intestine. Enterotoxigenic E. coli strains might express only a heat-labeled toxin or a heat-stable toxin or both of them. There is an intense and prolonged hypersecretion of water and chlorides, and reabsorption of sodium is inhibited. The gut lumen is distended with fluid, and hypermotility, beg your pardon, leading to diarrhea. The third pathotype of Escherichia coli is enteroinvasive E. coli, which is genetically, biochemically, and pathogenically closely related to Shigella. And several studies have shown that both of them share numerous characteristics at species level. The early phase of enteroinvasive E. coli pathogenesis include penetration of epithelial cell, lysis of endocytic vacuole, intracellular multiplication, directional movement through the cytoplasm, and extension into adjacent epithelial cell. Enteroaggregative E. coli is the fourth pathotype of Escherichia coli. It is the etiological agent of acute or chronic diarrhea in children and adults living in developing countries. They are characterized by their specific patterns of adherence or attachment to human cells, though the exact pathogenic mechanisms are still not completely elucidated. Some strains of enteroaggregative E. coli produce heat-stable-like toxin. Other strains produce a plasmid-encoded enterotoxin that elicits cellular damage, and others produce hemolysin. The fifth pathotype is the diffusely adherent E. coli. Diffusely adherent E. coli strains have been implicated as cause of diarrhea in children less than 12 months. They attach to epithelial cells through a fibril adhesin called F1845. They induce a cytopathic effect that is exhibited by the development of long cellular extensions that wrap around the adherent bacteria. The sixth pathotype of E. coli is the enterohemorrhagic E. coli. The key virulence factor of enterohemorrhagic E. coli is STX, which is also known as verocytotoxin. Enterohemorrhagic E. coli infection has a unique presentation with grossly bloody diarrhea, which is usually associated with E. coli serotype 0157H7. Most of these outbreaks have been related to consumption of contaminated beef. Enterohemorrhagic E. coli causes bloody diarrhea, which is also known as hemorrhagic colitis, and hemolytic uremic syndrome, HOS. After ingestion of the contaminated food, the organisms adhere to the epithelium and produce cytotoxins called sugar-like toxins or verotoxins, which inhibit protein synthesis and result in cellular destruction. Children usually present with watery diarrhea, low grade or no fever, and severe abdominal cramps. E. coli 0157H7 infection can cause hemolytic uremic syndrome in children. Here are some selected references for further reading. Thank you for listening.